Do distraction techniques for anxiety work, and are they a good thing or a bad thing? If you search distraction techniques on YouTube, you'll find some of the anxiety gurus and therapists recommending them, but others saying they are bad, even damaging. So in this video I explain the reasons for these mixed messages. I also look at some common distraction techniques and tell you if, when, and how you should use them. So first let's look at how distraction techniques might help. Amanda here suffers from panic attacks, and when she feels the panic attack coming, she focuses on her internal sensations like heart rate, her breathing, and her catastrophic thoughts, which makes the panic worse. So she uses the 5-4-3-2-1 technique. You know the one, you observe 5 things you can see, 4 things you can hear, 3 you can touch, 2 you can smell, and 1 you can taste. This grounds her and distracts her from the internal sensations and thoughts, and this helps to bring the level of the panic down. Now, some therapists would say that this is a safety behaviour because it avoids the thoughts and feelings, thus giving them power. They will also tell you that the best thing to do with a panic attack is to accept it and let it run its course. And they would be absolutely right. However, for many people with severe anxiety, this feels impossible. So in my view, using this grounding technique is okay in the short term. However, it should be used sparingly and eventually phased out as you learn how to manage your panic attacks, whether that be from my course on panic attacks or from your therapist. If you are using this technique excessively, it could make things worse in the long term. Now let's look at Rose, who suffers from intrusive thoughts. She gets the thought that she might harm someone. To distract herself from this awful thought, she plays a word game on her phone. But the problem is, the act of trying to distract herself from the intrusive thought gives the thought credibility, so it comes more often, causing more anxiety. So she spends more and more time playing the word game until it is a compulsion that dominates her life. You see, Rose has OCD, and distraction is definitely not a good strategy for OCD, as it makes it worse. But for some anxiety disorders, some distraction techniques can be good in some circumstances. Steve suffers from health anxiety and has learnt from my videos that seeking reassurance by Googling symptoms makes it worse. So when the thought comes that he might have a heart attack, to stop himself Googling, he goes for a brisk walk. This is a good use of distraction for 2 reasons. One, it has stopped him reassurance seeking, which usually fuels his anxiety. And 2, by exercising, he shows his subconscious mind that the negative thoughts about having a heart attack have no credibility. As a result, the subconscious mind realizes that there is no point sending this thought, because not only does he ignore it, he does exactly what his anxiety is telling him not to do. You see, the real test of whether any distraction technique is good or bad is what message is it sending your subconscious. Let's look at another example in panic disorder using Enid here. A popular so-called anxiety hack on TikTok is holding a handful of ice cubes. The idea being that the pain shocks you and distracts you from the panic attack. Now, there are mixed views on whether this helps at all, and again it could be argued that it is avoiding the feelings rather than accepting them. But let's take this a step further. Enid then has the idea to put the ice cubes on her face to cool herself down, because she feels hot when she has a panic attack. What message does this send her subconscious? It says, I must not be hot because it makes me have panic attacks, and panic attacks are dangerous, so I must prevent or stop them. The problem is, this action has reinforced an association between heat and panic attacks in her subconscious. So whenever she feels hot, she is more likely to have a panic attack. The best distraction technique of all is going on with your daily life. So if you've gone to the supermarket to do your shopping and you feel panic coming on, have a look at the beans that you were going to buy and see what's on offer, if that's what you would normally do. If you get an intrusive thought that you're going to die in a car crash, get in the car and prove it wrong. And if your health anxiety tells you your heart is going to stop at any minute, go exercise and show it just how strong and resilient your heart really is. If you have found this video useful, please give me a like and click on the notification bell to make sure YouTube shows you my next video.